Hey guys, it's the Med Study and today we're going to be having a look at multiple sclerosis. In this video, we'll be covering the basic pathophysiology, some of the causes, the key signs and symptoms to diagnose a patient, the disease patterns of this pathology, as well as the diagnosis and some of the treatment options. So let's get started. What is multiple sclerosis? This is a chronic and progressive disease whereby there is damage to the myelin sheath of the neurons, or otherwise known as demyelination. This is an inflammatory process that is caused by immune cells attacking the myelin. Let's have a look at this in a bit more detail. Myelin is made up of specific cells known as Schwann cells. They're present on the axons of the neurons. Having myelin means that it allows saltatory conduction to occur, whereby action potentials jump between the nodes. Hence, there is a faster rate of transmission. In patients with MS, they have a slower transmission, and signs and symptoms are present due to this. Those who are in early disease may experience remyelination, causing symptoms to resolve for a period of time. The exact cause is not certain, but there is some evidence that the following could contribute to multiple sclerosis. This includes Epstein-Barr virus, obesity, smoking, genetics, etc. The presentation is quite gradual and they can present in several different ways. Vision problems include, firstly, optic neuritis. Most patients initially present with optic neuritis, as this includes the demyelination of the optic nerve. There can also be double vision due to the damage of the abducens nerve. This is known as intranuclear ophthalmoplegia. Focal weakness can present as Bell's palsy, Horner syndrome, and limb paralysis. There are sensory symptoms such as paresthesia and the Lermit sign, which is an electrical shock-like sensation that occurs when the patient flexes their neck. This is due to the disease in the cervical spinal cord. And finally, they can also have problems with their coordination and movement, which is known as ataxia. These are just some of the signs and symptoms that you would see on a patient with multiple sclerosis. There are several different ways in which this can present, and this is based on the severity and the progression of the disease over time. Firstly, relapsing remitting. This is the most common pattern of presentation of multiple sclerosis. This is when initially the patient deteriorates due to the immune cells attacking the myelin. They then go into remission for a short period of time as these immune cells dampen down. The cycle then repeats. After each cycle, as you can see here, there is a gradual deterioration. Primary progressive is when there is a constant attack on the myelin sheath over time with no phases of remission. So the graph is a constant downward trajectory. Secondary progressive is similar to relapsing remitting, however, there are some phases of relapses with no remission. So over time, symptoms become more permanent and deteriorating. The investigations mainly include the use of MRI scans and lumbar puncture. The MRI scans can show lesions, as you can see here, and the lumbar puncture aims to look at oligoclonal bands in the CSF. Treatment for multiple sclerosis is still evolving, but currently disease-modifying drugs and biologic therapies are being used. Steroids such as methylprednisolone is used for episodes of relapses. Initially, this is taken orally and then IV if this has failed. Other management plans include looking at education, treating the neuropathic pain, physiotherapy, and treating the urge incontinence via oxybutynin. So now let's have a look at a few questions that you might get in an exam regarding multiple sclerosis. Number 1. A 30-year-old female is currently being investigated for multiple sclerosis. Which of the following is the most appropriate baseline investigation? So the answer is MRI with contrast. So our second question is, a 60-year-old female with a background of multiple sclerosis presents with a 3-day history of progressive loss of vision and a painful eye that's especially painful on eye movements. On examination, there's no visible eye changes. The acuity on the right eye is 6 out of 6 and the acuity on the left eye is 6 out of 18. There are no other symptoms and the fundoscopy is normal. Given the diagnosis, what is the treatment? So the answer is oral methylprednisolone. And that brings us to the end of this video. Hope you guys really enjoyed it. Remember to like, subscribe and comment below. And follow me on Instagram at TheMedStudier.